Okay. Good morning, everybody, and thank you for giving me this opportunity to present to you today. My name is Jennifer Mendez, and I am an associate professor at Wayne State University School of Medicine in Detroit, Michigan. There we go, we got it. I advise you to please feel free to just put your questions in the chat and we can go through them when we are done, or you can interrupt me and I'll be happy to go on then. I've put in my email address there. However, I think I also have it at the end. If not, Renata has my email and can send me questions if you have a problem putting them in the chat or wherever. I'm going to discuss today with you our interprofessional program using the interprofessional value scale to optimize team assessment. Our objectives for this was to utilize the scale to understand and determine our students' readiness to function in teams and the difference between 9 disciplines of students' comfort in working in teams. This program has been running for 13 years. We started out with using the readiness for interprofessional team visits and found as the years were going on, many of our students were already aware of that tool. So we decided to try this additional tool. The disciplines that are participating in the program is, of course, medicine. Medicine are year 2 level students. Pharmacy is year 2 and 3. Social work is BSW. Nursing is BSN. Physical therapy is year 1, occupational therapy year 1 and 2, athletic therapy year 2, physician assistant year 2. We try to there are over 1,000 students in the program, so we are very lucky to have at least 3 professions in one team. We do it twice to accommodate the 1,000 students. However, the students only do it once. And we randomly select an adult participant in the program. This pre and post interprofessional socialization valuing scale that I'm discussing with you today is a pre and post. However, during the actual visit, the students use their own specific instruments, and I can speak about the instruments in more detail if you want, but I haven't prepared a slide on that for you today. Our recruitment of our patients, we have at the Detroit Riverfront, we normally have every Tuesday and Thursday about 700 persons that walk along the river between 8 a.m. and 10 a.m. So what we decided to do to take advantage of this wonderful group of people there was to set up a table with the consent of the Detroit Conservatory to put up a table and have 3 tables around with students taking blood pressure. And after they finish taking the blood pressure, they ask the individuals if they're willing to participate in our program, which 99.9% say yes, they'd love to do it because they love interacting with the students. They've got to know the students as they're doing this because they see them every Tuesday, Thursday. However, with the pandemic, we had to make some changes, and we just started again in terms of the riverfront, but we're only doing it Tuesdays now just to get slowly back into the routine of things. However, our family, friends, and neighbors were very worried about our program because they know how long it's been running, and they decided to themselves offer to be volunteers or get their friends to be volunteers or neighbors to be volunteers. So we lowered the age rate from 65 to 50 in order to accommodate this challenge that we had. And we were able to very successfully, with our prior patients who agreed to participating and the new patients, we have a data bank of about 160 patients. We also use our community agencies for this, and we did not go into the homes of any of the patients this time around. We did it by Zoom because of the restrictions by the governor in terms of small gatherings. The feedback from the patients as to why they want to do it, the topmost 90% was educating future care practitioners. We've not had a dropout of our patients from the time we started. However, we've had a couple that had to move out of state and were so glad when we said we were going into doing it by Zoom. They're participating. So we have some patients in Canada as well. Since we're a border state, we do have patients in Canada. So in terms of the instrument, the three areas that we looked at was self-perceived ability to work with others, the value in working with others, and the comfort level of working with others. And this instrument was looking at the analysis of the instrument itself. It showed a good fit for our program and the ability to use SPSS, and it has 26 descriptive statistics for these teams that was beneficial for our program. And we use paired sample to pre and post comparison. This is the actual instrument. Give me a second. I'm going to move this and talk. Yeah, go ahead. Whoever was asking a question. I can't see you, so please speak up. Was there a question? Okay, then I'll get into the actual instrument. This is instrument by King, Orchard, and Khalil. We used a 2016 version. There is a 2010 version. However, we wanted the most recent version, so we used this version. The difference between the two, I think, was the scale in here. As you can see, there are 7 levels in which you can respond to, and I think the prior one had 5 in it. And so we thought this was because there are things that were not at all related to what people would like to see in a scale. So this was more beneficial for us. So I'm not going to read the scale because this PowerPoint will be shared with you. You can read it at your own time. But as I said, it was comfort level, value, and this is the number of...
This is Heidi. I have one question.
Sure.
And this is a crucial question. Is there more practitioners coming into the field than an actual doctor? Because in Minnesota, I had a clinic I went to, and they changed how they run the clinic, and the clinic is now all practitioners, you know.
Yeah.
And
so that's
then, then they all those doctors decided, because they had to leave that clinic, built their own clinic, and then we hunted it down, and then a lot of people are now going to that clinic because they wanted to keep their doctor through the pandemic, and also they didn't like the changes. So I was just wondering in your data or any of the work you're doing, if you notice, a trend of one direction more than another.
Okay, so two responses to your question. The first is the data that I'm sharing with you is our program with students. They're not physicians yet. They're physicians in training. They're year 2 medical students. All the other disciplines are also students. In terms to answer your question more generically, the second part is that many of the practitioners during COVID lost their actual practice plans and then decided to go into private practice themselves because many of them were not seeing as many patients, like in this case, these are older adult patients that were willing to come to the hospital because their ride shares were not available and they were not comfortable with using Zoom or any of the electronic means. However, we did, Wayne State University medical students worked with our Detroit area agency on aging to provide training for older adults on how to utilize iPhones, Android phones, tablets, Chromebooks, your laptops. So many of the patients that were not interacting with their physicians between, say, July and November of last year really picked it up again in December, January, because they did have the tools to communicate directly with their primary care physicians. I hope I answered your question, Heidi.
Yeah,
if not,
I just thought it was interesting because I just wanted to know how many students are going in a certain direction because we're losing certain types of people.
I can't tell you that because right now our graduating class of 99.9% actually matched. So we had a very good match. And I'm assuming every one of them is doing it via Zoom right now with their patients because they're so used to it. However, it's
All
up
right.
to the patient more than the actual practitioner. Okay.
Yeah, I actually lived through the pandemic. I lived doing it over electronically, so I
Okay,
had to
great.
learn.
Good for you. Okay, so next slide. This is the number of students. As I told you, we have over 1,000 students. So these are our 9 professional programs. And this is the amount, as you can see, the percentage-wise. The highest percent, of course, were medical students, followed by dental and pharmacy students. Then we had BSN and BSW. Okay. And our athletic therapy is a very small program, so therefore you see that's only 0.5%. In terms of the disciplines, as I said, each team had about 3 disciplines. So as you can see, the first one was athletic therapy, bachelor's in nursing and bachelor's in social work. However, given that we had extra medical students, you will see there are some teams here with only 2 disciplines. So for instance, medical students with an occupational therapy student or medical students with a physician assistant student. This is the pre and post data. As you can see from any of those that I shared with you, the questionnaire, we had very positive results in all that they were very comfortable working with each other. They valued each other and it's too busy a slide to spend too much time on it, but you can take a look at it later. Here's the paired sample, again, similar to what you saw in the other statistics. It is pretty positive. And in terms of my discussion with you, I can say the confidence ability of our students was associated with positive outcomes. They found more social interactions and they were more comfortable working in other tasks. One of the tasks that our students had was after the visit, they had to create a resource for the patient. So if the patient said, I need more information about how to connect with my doctor, then they had to create a resource guide for that patient on connecting with their doctor. Majority of the responses from the participant patients was, how do I connect with my family? What do I do to get in touch with them? How do I have better food nutrition brought over to me at home? I don't want to use Meals on Wheels. So a lot of how to order out using your cell phone or your laptop. A lot of them were also asking about the not wanting to use a fryer in the house because they were worried about flames. And so teaching them how to use other means for cooking. In terms of their ability with the older adults, they were our students were very happy with that. As I told you, they created all these apps for them, not apps, but did one-on-one tutoring on how to use their electronic devices. So it was very interesting. We are getting a lot of feedback from business and engineering students that would like to participate. But for me, my bandwidth with 1,055 students is already stretched. So trying to get any more, I think, will be tough. But who knows, maybe in the future. And as I'm presenting to you today, you can see it's a pretty comfortable module that anybody else can take it for building their own workforces. Our limitations, we didn't have a control group. We only did it once, as I mentioned to you, and we did have 15 teams of students of 2 because we didn't have the additional, another 15 students to make it teams of 3. But we had over 340 teams of students with 3, so that's a pretty good outcome. Future research, we want to now use our same tool again and evaluate some more using more of other experiential research designs. Like I said, we only did a t-test. This is our references, and you will get these slides so you can go through the references too. So my contact information is here again, and you can get in touch with me.